Stretching from the temperate climate of the south to the dry desert sands of the north, Mali is a landlocked nation in West Africa that is nearly twice the size of Texas. Bamako, the bustling capital, lies in the south. In 2006, this rapidly growing city was where three young women from Brown University and a group of local midwives set out to improve the lives of some of the poorest women and children in Mali. Mali Health operates in the underdeveloped and overcrowded communities on the outskirts of Bamako. These neighborhoods are characterized by high levels of poverty and low levels of education. We focus on families falling in the bottom 20% of the income spectrum. 4 out of 5 women in these families never progressed beyond a grade school education, and a full 60% never attended school at all. 3/4 of these women have only informal employment, usually selling goods in the marketplace. They work creatively and tirelessly to provide for their families, but for most, it's not enough. The families in our programs access healthcare at alarmingly low rates. With their meager and unsteady income, women must attempt to cover all of their family's needs, from food to school fees to healthcare. With their limited resources, healthcare is often delayed until it becomes critical, and thus often ends up requiring more complex and costly treatment than if it had been sought early on. This is where the Savings for Health program comes in. For generations, Malian women have gathered in small groups to pool and share resources to help one another meet any number of needs. We have adapted this familiar concept in practice and harnessed its impact specifically to improve families' access to healthcare. Weekly, women gather in groups of 15 to 25 members. Mali Health facilitators lead health education lessons with the group to learn about common and important health issues like preventing malaria and the importance of attending prenatal care visits. After the health education lesson, women contribute a small amount of money into a collective lockbox, an amount that the group members decide for themselves. The collected funds are then made available to group members for one of two uses. Women can withdraw no-interest loans to help them pay for healthcare expenses, like a visit to the health center or new mosquito nets for their home. They can also withdraw interest-bearing loans to support activities that will help them build their income, such as starting a small business or learning a trade. When the financial burden of healthcare is placed on these collective funds rather than on a single family, health services become immediately more accessible to those who need them. Health loans can be taken rapidly, so women can seek care for themselves or their children as soon as an illness begins, and they will work with their fellow group members to set a reasonable, achievable timeline for repaying those funds so that they will once again be available to group members to withdraw as needed. As of January 2017, nearly 4,700 women participate in savings groups, and group members have used small loans to seek health care over 6,000 times since the program began in 2013. Without access to loans through Savings for Health, the majority of those health center visits would likely never have happened, and families would have remained sicker for longer. To better illustrate the impact this program has had, here we share two women's stories. Jenabu Kamara credits her savings group with helping her to keep her family healthy. When her son became ill with malaria, she was able to take him to the health center quickly, which likely saved his life. After spending a long and restless night with my son, she says, I quickly took a loan to bring him to the health center. This small amount could be enough to save my son from malaria. Several days later, Jenabu's son was back on his feet. For Hassan, a young woman in Lhasa, her savings group may have helped her save her own life. After awaking one day with great trouble breathing, a nurse diagnosed a severe respiratory infection. Hassan could not afford the medication she was prescribed, so she returned home, resigned to waiting the infection out. Luckily, a friend and fellow savings group member stopped by that afternoon. The friend helped Hassan withdraw a loan from the group so she could purchase the medicine she needed. After 2 days, Hassan was improving rapidly. Able then to return to work, she repaid her loan in no time at all. The positions that Jenabu and Hassan found themselves in are far too common in Mali. But with the help of Dining for Women's incredible members, we will be able to continue ensuring that healthcare costs do not drive families deeper into poverty. Instead, We will build on the resilience and generosity of these amazing women to open new doors to opportunity for all.